I think he's broken his ACL as well as multiple ligaments of his knee. It's a very, very bad injury and looks as if he has broken multiple ligaments. Most predominantly looks like his ACL. And I think I had already spoken once about ACL injuries, but for those who have not seen that video of mine, I'll just show. So this is our thigh bone, that is what we call as the femur, and this is the leg bone called as the tibia. And we have two ligaments which are on the sides of the knee. This is the outer side of the knee and the inner side. And inside the knee we have two ligaments, which is one is in the front and one is in behind. So the one in the front is called as the anterior cruciate ligament and behind is called as the posterior cruciate ligament. And on the inner side is your medial collateral ligament and this is the lateral collateral ligament. So now, especially when a football player falls with an injury like this, he has usually broken his ACL for sure, and maybe one of his collateral or at least the meniscus. But this injury which we saw in the video is quite a bad injury, and I believe he must have broken his ACL for sure only, and maybe a collateral ligament also. It's a real bad injury to have, but of course we can treat it with modern science and with modern techniques. We can always treat these kind of injuries, and they can also rejoin their sports activities once their rehabilitation is done. So now we saw one video of football, and now we are seeing a video of a basketball player who has landed improperly on his leg after he jumped to slam dunk it. Now what happens is, now we could see he could get up from the position where he had a fall or he landed improperly. So that means his hip and knee looks okay, but what has happened is he can't give the weight on his leg, so his ankle is injured. Whenever such an injury happens, the next thing to do is to diagnose how the injury has happened or what exactly is wrong. So maybe first thing to do is an X-ray. If the X-ray doesn't reveal that there is any fracture or the bone is not broken, then the next thing would be to do an MRI to assess his ligaments around the ankle joint. Now the ankle joint also has ligaments around it, not inside it though, and it's also quite a stable joint. And especially for athletes, all sports people, it's important that they have good ankle stability. Otherwise, they will end up with ankle injuries. If it's a minor ankle sprain, it would be just treated with some kind of an immobilization with either an ankle binder, which is like a crepe bandage, but a little modified, which is gives more compression. If it's severe, then maybe a plaster, and if it's a complete tear of the ligament, then it will need a surgery where again we try to either repair or reconstruct the ligaments with the help of the same ligament if it's in a good condition. If it is not, then we again take some extra tendons which are there in the body, make a ligament out of it and fix it up in the bones. But I would ask all of you guys to take these kind of injuries very seriously. Get it attended by a specialist so that proper treatment is done. Once the immobilization and rest treatment is over, the person or the patient needs to do good amount of rehabilitation with physiotherapy and also with an occupational therapist. I would like to request all the subscribers to share the video, share the channel, and ask their friends also to subscribe to my channel. Thank you, and we'll try to keep this content as far as possible in simple words in English so that सबको समझ में आए एंड इन्फॉर्मेटिव. अगर आपके पास कुछ भी ऑर्थोपेडिक रिलेटेड क्वेश्चंस हो जो मैं आंसर कर सकूँ, आप प्लीज़ कमेंट्स में लिख दीजिए ताकि नेक्स्ट जो भी मैं वीडियोस बनाऊँ उसमें मैं वो कंटेंट के बारे में इंफॉर्मेशन दूँ.